Okay,
Beginning with the urinary system.
here we go. Big time.
Woo.
5, 4, 3, 2, 1. The urinary system is a very complex system of the body with a very, very simple design. The design of this is brilliant, right? You have 2 kidneys with 2 ureters, with 1 urinary bladder, with 1 urethra. And what is it that kidneys do?
Filter.
They filter. What do they filter?
Blood.
The blood. And what do they filter out of the blood?
Waste.
Waste. And what type of waste is that?
Metabolic.
Metabolic waste, not waste, leftover waste. This is waste we've created through metabolism. So that's that nitrogen-based waste, or nitrogenous waste, excuse me. So if you look here, the purpose of the urinary system is regulate the composition of blood and remove waste products from the body. Purpose is to regulate the composition of blood and remove waste products from the body. This is done by the production through filtration, concentration, storage, and excretion of urine. Adults produce 12 to 1,500 cc's of urine. That's about 1 to 3 quarts of urine every day. And of course, it starts with the kidneys. There are 2 kidneys. The right kidney is slightly lower than the left kidney. Why is that?
Right lung's bigger?
The liver.
Oh, the liver.
The liver
Oh,
takes
that
up a lot of room on the right side. So the right kidney is about 1 vertebra lower. Each kidney is about 4 inches in length, 2 inches wide, and weighs about half a pound, less than half a pound. Reddish brown in color, and they are shaped, not surprisingly, like a kidney bean. They are located in an area we call the retroperitoneal space, or in the flank of the back. In other words, they're more towards the back. There's still a little diaphragm though. Each kidney is topped off with an adrenal gland. We talked about that way back in the endocrine system. The little adrenal gland that sits on top of each one. You might remember that. Each kidney has a hilum, this indented area where everything goes into or out of it. So we have the renal artery that goes in, the renal vein that comes out, and the ureter that comes out all in one place. Most of the outer layer is a fibrous connective tissue capsule around the kidney. Then beneath that we have the cortex, and then the inner part is the medulla. You'll notice if you look at a kidney, like here, there are these pyramidal shapes. Now it looks sort of like triangular almost shapes, but in 3 dimension they're more like a pyramid with a base and a tip that goes to here. And that's because as urine is created through here, it drains this way. And it drains towards these little funnels here called a minor calyce. And several minor calyces come together to make a major calyx, like this. And then that all drains into this funnel-shaped part called the renal pelvis, which then becomes the ureter, which leaves the kidney. Each kidney has a ureter draining from the hilum into the urinary bladder. Each ureter is about a 12-inch tube with layers of smooth muscle on its walls. Well, we know if there's muscles in the walls of a tube, what's it going to do? Contract, pushing the urine down from the kidney to the bladder. It's not gutter. It's not like a gutter-fed gravity system where it just drains down. It's actually pushed down, which means you could be standing on your head and urine is still being pushed from the kidneys into your urinary bladder. Peristalsis, we talked about that before. The urinary bladder is located in the pelvic cavity. There's a hollow muscular organ, muscular because it's going to be pushing urine out. It is a storage site. So notice we have 2 ureters draining in from each kidney, left and right, and they're draining into this spot here and here. drains out here, so you can sort of see this little triangular area we call the trigon right here. But there are, you can kind of see the little folds in here of rugae, just like we'd see in the stomach, that allows it to expand and contract, expand so it can hold more urine. Urinary bladder holds about 400 milliliters of urine. More for drinking coffee. The top of the urinary bladder is called the dome or the fundus. I like the term fundus because we're going to see the term fundus other times. We saw it with the stomach and the gastrointestinal system. The rounded dome-shaped part of the stomach was called the fundus. We'll see it in the female reproductive system. The rounded dome-shaped part of the uterus is called the fundus. So it's just a good term to know. You see that the bladder sort of gets narrow, more narrow here as it goes into the bladder neck. And then we have a doorway. We have a muscular doorway called a sphincter. And in fact, we have two muscular doorways. One is more internal, one is more external. The internal urethral sphincter, we do not have control over. So when the body decides the bladder needs to be emptied, that doorway opens. So we don't have control here. We do have control there, however.
So when we have the like gotta go feeling.
Gotta go, gotta go, gotta go.
Yeah, it's because that
Right now.
internal sphincter is released.
It's because the bladder's full and the internal urethral sphincter is relaxing.
So
That's
does that
because
mean
the
that the
bladder's full
urine
and it's like, I'm sorry,
does that mean that the urine is sort of in the urethra
it's starting
up
to
till
go
the
into the urethra.
gotcha, like up till the external
Yes.
sphincter. Gotcha.
Yeah. You can see all the muscle on the walls of the bladder here. That's going to help push the urine out. On the top of page 95, if you have the notes in front of you, remember the notes are not necessary for your success in this course, they're merely operating agreements. Similar information can be found in other textbook and reference materials. But if you look on the top of page 95, the urethra is a tube that carries urine from the bladder to the outside world. Toward this distal end is the external urethral sphincter. This is where we have voluntary control. The opening of the urethra is called the urethral meatus. I know you want to say meatus, M-E-A-T-U-S. It is pronounced meatus. Just a good term to know. In men, the urethra is 7 to 8 inches long. In females, it's 1 to 2 inches long. This is why women are so much more prone to getting urinary tract infections, because that short urethra allows the bacteria to ascend. And if they ascend, they can make their way right in here into these folds. And now the bacteria can just hide in there and create an infection. In men, it's much more difficult because it's a longer journey for the bacteria. It's much more likely that urine is going to come and push them on out. Again, this is why we say, ladies, make sure that you empty your bladder post-coitus. The male urethra is unique in that it passes through the prostate gland, so the prostate gland surrounds the urethra like this. And the urethra in the male is also unique because
It carries two.
it carries not just urine,
But also semen.
but also semen. Okay, now here's where the fun begins. This is the physiology part. This is the complicated part.
Wow.
This gets exceptionally complicated very, very fast. Let's turn back here for a moment. We are only going to scratch the surface of it. This right here is called a nephron. This right here is called a nephron. This is the functional unit of the kidney. This is the parenchyma. This is the thing that actually does the job of filtering. And here we have two nephrons. There's one here and one here. But you have to realize that each kidney has about 1 million of them. So there's a lot of these things at work. So here's what happens. As blood comes in from the renal artery and it branches off into smaller arteries, which branches off into these afferent arterioles, it goes into that first ball-shaped portion of the nephron, called the Bowman's capsule, the glomerular capsule. And you can see it here in this picture a little bit better. So here we have an afferent arteriole bringing blood in, and you'll notice this Bowman's capsule surrounds this. As the afferent arteriole comes in, it branches off into a network of capillaries called the glomerulus. So as blood is coming through here with all these waste products, the waste products are getting filtered out through the force of blood pressure. We're filtering out waste products, but we're also filtering out some good stuff too. We're filtering out stuff that we might want to keep, including a lot of water. Then anything that is too big to fit through this filter, you'll see it comes back together as an efferent arteriole that leaves the Bowman's capsule. Meanwhile, all that stuff that we've collected inside of that Bowman's capsule is what we call filtrate. We don't call it urine yet, we call it filtrate. That filtrate moves from the Bowman's capsule into this first part here called the proximal convoluted tubule. Don't get confused. Tubule is a fancy word for a little tube. Convoluted means it has a lot of twists and turns to it, kind of like the excuses you come up with that you can't take a test. And then proximal means, well, closer to the beginning as compared to distal. So when we call this first tube here the proximal convoluted tubule, we're just saying it's a little tube that has a lot of twists and turns to it, and it's closer to the Bowman's capsule. So the filtrate goes from the Bowman's capsule here to the proximal convoluted tubule, then it goes down into this loop of Henle,
Man, I'm pronouncing something wrong.
named after Henle. And then that loop continues back up into another convoluted tubule. This one we call the distal convoluted tubule. So the filtrate is making this journey. This is all the stuff that we filtered out of the blood, all those waste products, but also some good stuff, including water. And that filtrate is going to make its way to a collecting duct here, which we see in this pyramid, this renal pyramid, is going to collect from all these other nephrons, all that filtrate. At this point, when it's in the collecting duct, we call it urine. And that's all going to drain into a minor callus, to a major callus, to the renal pelvis, to the ureter, to the bladder, to the urethra, to the outside world. Now, here's where it starts to get a little tricky. Because remember, I said we filtered out waste products, but we also filtered out some stuff that we want. So if we just go back a picture here, I want you to look at the afferent arteriole coming into the Bowman's capsule. Inside is going to branch off of that glomerulus, and then it comes back out of the efferent arteriole. But notice what it does. It wraps around that nephron. You see, we didn't see it in this picture. We didn't see it wrapping around here. But when that efferent arteriole leaves, it wraps around the nephron. And you can see it wrapping around here. So it's in communication, they're touching, all right? The sides of the proximal convoluted tubule, the loop found in distal convoluted tubule. The reason for that is because we may want some of that good stuff back into the blood. So here we have the ability to reabsorb some stuff back into the blood, like water, for instance. If we want to bring water back in, or sodium, which of course is going to cause water to come back in. And then you see how this efferent arteriole then goes back as the renal vein. But that's where the physiology gets really complicated, in that reabsorption process. We'd actually even still filter out some stuff here, but most of this is going to be for reabsorption. We want to bring stuff back into the blood that we lost that we didn't want to lose. Complicated process, I know. And again, it gets much more complicated. I'm just giving you an overview of it. But the nephron is the functional unit and includes all of these parts. All of these parts. So follow along in the notes for just a moment. The renal arteriole enters the Bowman's capsule and divides into a network of capillaries called the glomerulus. The blood flowing through the glomerulus carries both waste products and good stuff. The waste products, blah, 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 we talked about those, the good stuff, electrolytes, glucose, water, etc. The capillaries that are in that glomerulus have little tiny pores, little openings, so they're going to allow stuff to get pushed through and collected in the Bowman's capsule. This is done passively, no energy is required for this. This is all the result of blood pressure pushing it through. This process is what we call filtration, which I bold printed for you there as if to imply it has some upcoming importance on Thursday. Test question number 14. Particles are in the blood, they're too large, they stay in the blood, the capillaries combine, leave the Bowman's capsule, but continue to travel along the rest of the nephron as that efferent arteriole. The waste product or filtrate includes all that water, all that other stuff, flow from the Bowman's capsule into the proximal convoluted tubule, and then it continues as a segment known as that loop of Henle, and there all that waste flows into the distal convoluted tubule. All of that time we have the opportunity for reabsorption to occur. Once that filtrate makes it to the collecting duct, we can no longer reabsorb anything. So now we can call that urine, because that's what's going to drain eventually into the urinary bladder and then out to the world. The distal convoluted tubules of many nephrons empty into the collecting duct. At this point, we call fluid urine. So I think somewhere in your review questions, there's a question about filtrate leaving the Bowman's capsule, then flows into the proximally convoluted tubule, then into the loop of Henle, then into the distal convoluted tubule. I think we've seen that, right?
Yep.
Yes. Good. Good, good, good. Oh, the kidneys, they're such good organs. Are they the most important organ?
No.
Mm-mm. What's the most important organ?
Liver. Or the brain. That's not, I was thinking out there. I was thinking
Think
down
about it, the brain.
there.
What's the second most important?
Liver. Heart.
Heart.
Gotcha.
And then what's third?
Liver. Damn, what is it?
Kidneys.
Oh, wow.
Brain,
Oh,
heart,
right.
kidneys, always in that order.
Oh,
Brain, heart,
goodness.
kidneys, always in that order. Why are the kidneys so important? Well, obviously, they're doing a big part in getting rid of that waste product. If that stuff builds up in the blood, it will affect the brain, it will affect the neurons. Cause confusion, delirium. I mean, imagine, imagine police officers bringing in a handcuffed suspect into an emergency room who's screaming and yelling and trying to fight with everyone. The first thing you might think is, this guy's crazy. Then you might think, oh, this guy's on drugs. You probably wouldn't think, oh, this guy's kidneys are failing. However, in medicine, we have to think in reverse. We have to think the opposite way. We have to think, what is causing this guy's brain to act the way that it is? Is there an organic cause? Maybe there's a tumor. Maybe there is a problem with his kidneys. So we got to check all of that. Then we could also check his blood for alcohol or drugs. And then if all of that is normal, that like we can't see anything, then we call for a psych consult. So it kind of works in reverse for us. We have to rule out the other stuff that we can test for first.
Wouldn't it be crazy? I think because you go to jail, you can take him to the hospital, right? I don't think.
What if they're acting crazy and they're saying Abraham Lincoln is telling me to kill everybody?
Do you take him to the hospital when you're saying that? I thought you still go to jail, but then you figure it out.
Not if there's an obvious problem. All right, let's look at other functions of the kidneys. Making these things so darn important. Number one, blood pressure regulation. Number one, blood pressure regulation. Aldosterone, we talked about aldosterone before, is going to cause sodium to come into the blood. Sodium comes into the blood, water is going to follow salt. What's that going to do for blood pressure?
Higher.
It's going to increase blood pressure. Antidiuretic hormone causes water channels to open up. That brings water into the blood. If we bring more water into the blood, what's that going to do for blood pressure?
Lower it. Or
Bring
higher,
more
I'm
water
sorry.
into the blood, it's going to increase blood pressure. But there's also some specialized cells, these juxtaglomerular cells, that are pressure sensing cells. So when these cells sense that blood pressure coming into the kidneys is low, they're going to release a substance called renin. And renin is then going to activate angiotensinogen. And angiotensinogen is then going to convert to angiotensin 1. Angiotensin 1 is then going to go to the lungs where it's converted to angiotensin 2 using the angiotensin converting enzyme. Angiotensin 2 is then going to go out, and the first thing it's going to do is increase peripheral resistance, constriction of the vessels. That's going to raise blood pressure. That's the first thing it's going to do. Secondarily, it increases by volume as well, but initially, it's a resistance. That's really, really, really important for medical students to understand. Not you. What you need to understand is, what are the other functions of the kidneys? Number one, blood pressure regulation.
Oh, other function.
Number one, blood pressure regulation. What's the other function of the kidneys? Number two, blood pH regulation. Remember, the pH of the blood is around 7.4. If that pH starts to go too low, if it becomes too acidic, well, we're going to have to do something to raise the pH. We're going to have to buffer it. The kidneys can make bicarbonate, HCO3 minus, through a process we call de novo synthesis, which is fancy chemical talk for from scratch. So bicarbonate is the most potent buffer that we have in our blood. So if the blood becomes too acidic, we can buffer it with the kidneys making this all on its own. That's pretty impressive. But do you need to know that? No. What you do need to know, however, is that other function of the kidneys, number two, blood pH regulation. You need to know that. Other function of the kidneys, number three, red blood cell production. But the kidneys don't make red blood cells. Where are red blood cells made? Where are red blood cells made? Where are all blood cells made?
Everywhere.
No,
In the lung,
no,
the heart, the brain,
no. Blood cells aren't made in the brain.
kidneys.
They said they don't made in the kidneys.
Oh.
All blood cells are made in the bone marrow.
Oh.
All blood cells are made in the bone marrow.
Blood marrow. I mean, red blood or
All blood cells, red blood cells, white blood cells, platelets are all made in the bone marrow. We talked about this. Hurts my heart.
It's brain fart. That's all.
We talked about this. All blood cells are made in the bone marrow. However, if the kidneys suspect that we've suddenly lost a lot of blood, well, if we lost a lot of blood, that means we lost a lot of red blood cells. So the kidneys will send a message to the bone marrow in the form of erythropoietin, which I think is also on your final exam review. And erythropoietin will tell the bone marrow, make more red blood cells, and take the ones that you've already created and make them faster. So you do need to know other functions of the kidneys, number three, red blood cell production, in the form of the release of erythropoietin. So you do need to know what erythropoietin does. It's also in the hematology chapter. So this is something that's come up twice, the erythropoietin. You need to know about the erythropoietin. All right, let's look at pathology. Kidneys going well, and good kidneys go bad. The first one you see there is glomerulonephritis. Lots of things can cause glomerulonephritis, but the one that you're going to hear about is an acute proliferative post-streptococcal post-infectious glomerulonephritis. This is going to occur 2 to 4 weeks or so after a person has been diagnosed with a group A beta hemolytic streptococcal pyogenes infection of the pharynx, which is what we call strep throat.
I have stuff with.
Yes, strep throat is bad. So the body produces antibodies to try to fight it off. Those antibodies actually cause problems in the filter of our kidneys. Causes inflammation, acute glomerulonephritis. Hydronephrosis. What does hydro mean? Water. So this is water on the kidney? Yeah, kind of. Cause the kidney to look like this. Swell up. This is usually the result of some sort of outflow obstruction. In other words, a kidney stone is in the way, it's not allowing the urine to flow out of the kidney down the ureter into the bladder, so it backs up and backs up and backs up and causes the kidney to swell. Why is that bad? So the kidney's a little swollen, who cares?
Because it's
What do you
filtering.
mean?
Yeah, it's filtering, yeah, but it could, but how? If this is swelling up, it's putting pressure on itself, which means all those little filters can get destroyed, all those little blood vessels can get destroyed, so it can destroy itself. We don't want this to happen. Don't let this happen. No hydronephrosis. No hydronephrosis. Say it with me.
No hydronephrosis.
No hydronephrosis.
With conviction. Heck no, we won't go with hydronephrosis. Urolithiasis, nephrolithiasis. What does litho mean? Litho.
Litho means, oh gosh, I hate this.
No.
No, you told us yesterday.
Litho
Oh my gosh.
And I asked you,
means
I asked
stone.
myself.
Stone, yes.
Litho means
Wow.
stone. What does nephro mean?
Kidney,
Kidney. What does uro mean?
urine.
Urine. That's why this could be called urolithiasis or nephrolithiasis. Kidney stone.
So nephro and how you pronounce the kidney?
Reno?
No, the other one.
Uro?
No.
I don't know
You
which
said
one.
you said kidney. You said kidney is
Renal or nephro?
nephro.
Yes.
Nephro and neph. Cause they sound alike.
Nephro?
Nephro and what else?
Renal.
No,
Yeah,
I'm
renal.
saying no. The stone part.
Litho.
Litho
Litho
is
means
stone.
stone.
And
Nephro,
Neph-
nephro,
nephro.
yes.
Nephro.
Is kidney.
Nephro is the kidney. And
Litho,
litho
is stone.
nephro.
And these stones are made of mostly of what?
calcium,
Calcium. So look what they look like.
hard.
Oh wow.
Yeah.
Yeah, dude, ow.
Yeah.
That
Like
really just
crystal.
hurts even looking
Like a
at
hard crystal.
it.
And of course, they can get stuck in the renal pelvis, they can get stuck in the ureter,
The
especially
hard
on the bed,
kidney.
or ureter here, or down to the bladder. And that's bad because, of course, like I said, things can back up. What's next on that list? Is it
Diabetic.
diabetic?
Nephropathy. Nephropathy.
Nephropathy?
Nephropathy.
Is that what you're saying?
Nephropathy.
Diabetic nephropathy.
Nephropathy.
So, did we talk about this at all? Did we talk about
I've heard of
diabetes?
Yeah.
Nephropathy.
Did we talk about the kidneys failing?
Yeah.
They talk about how somewhere between 60 and 80% of all people on dialysis in this country are on dialysis because of diabetes.
Yes.
Yes, I did. So I'm not going to talk about diabetic nephropathy anymore because you understand it.
Sounds great.
completely. Polycystic kidney disease. What does poly mean?
Many.
Lots of
Much.
many, yes. So
Many cysts in the kidney.
many cysts in the kidney. Let's take a look and see what that looks like.
Not good.
This
Oh!
would be an artist rendition of what polycystic kidney disease look like, and this would be
Oh, look at
What
the
in the-
holes, look at the holes.
There's actually 3 kidneys in this picture. Here's one,
Yeah.
this one here is butterfly, like you do with
Oh,
a
they
chicken
flipped
breast. Like you cut it this way, then
Mm-hmm.
open it up, you know, how you got a chicken
That's
That's
breast.
what they did, they
That's
opened that?
This is the kidney,
Yeah, and
and
then
they cut it and they opened it like this. You see all those holes, those are the cysts
Yeah.
inside, so it's not just cysts on the kidney, it's all throughout the kidney.
cysts have overcome the kidney.
Yes,
Wow.
Goodness.
which means what are the kidneys gonna do now? Are they gonna be able to filter?
No.
Nope.
They're just gonna fail,
This
die.
accounts for about 10% of all the people in the United States who are on dialysis.
Oh my goodness.
This is an adult polycystic kidney disease, because it is in both kidneys. The
How's that
childhood type is much less common, and it usually only affects one kidney. So that's at least good.
Is this because it's asymptomatic at first or something, that it gets this far?
Yeah.
Wow. And what causes it?
Bad DNA.
Oh, well, even better.
Yeah. This is not caused by drinking or drugs or smoking
Interesting.
or spitting on the sidewalk or swearing in church. This is just bad genes.
So this is in both type 1 and type 2 diabetes?
This is not diabetes. This is separate. Separate.
Wow.
So why do they have a third kidney?
So what? Does
Why do they have a third kidney?
Did they try to?
oh,
put
that's
one in?
that's in one person.
Did they try to put a new
They
one
needed
in?
they needed something else to give it a boost. That little
Yeah.
kidney.
It's a transplant.
So they just didn't take out the
That's
product
what I
one or the
They said, yeah. Why would they do
You were correct.
stop?
They did not take out the other ones.
that? Why?
And the reason for that is because they can still often do things like help regulate blood pressure and release erythropoietin.
That
So they usually keep the other kidneys in.
That looks useless to me.
But where would that one go? Where would that?
They make another connection. I don't know where they make the connection.
It looks like they attach it to
No, I'm saying
Obviously,
like
it has
in your body.
Obviously, it has to have arterial blood coming through it, like from the aorta. But I don't know exactly where.
why wouldn't they just at least remove one of them and just attach it regularly?
Because again, the other kidneys can still be doing those other jobs.
Wow. And they can't sit on top of each other.
I wouldn't keep that in me. If I knew that was what was in my body, cut it out. Give me one
Cut it.
nice one that works and does everything.
Well, that's just it. That other one might not do everything. It might filter, but it might not be releasing those hormones. Like
So the one that you already have can take.
Because
on
the connection's
the
not
other-
right.
the
So
new
basically,
one
I don't
may
know
not
which
do.
one is working, right?
Lots of people are talking about it at one time, and I don't know what anyone actually said.
Yep. I thought that basically, the reason why they don't take them out is because they don't know which one is like filtering, which one is like, they don't know which one is actually doing the job, is that right?
No, they can still figure out which one's doing the
So
job,
it's still
which one's
just-
working better. You still have a pretty good idea.
Oh my
But-
goodness.
Again, it comes down to the other things that the kidneys do, not the filtering part. What was your question?
I just wanna know, like, I need to see a video where they put it, like,
Okay, watch a video where they put it.
it's crazy.
It's not crazy, crazy psychiatry.
What would you look up, like polycystic kidney disease, kidney
Or
transplant?
just kidney transplant.
I was like,
But I wanna see specifically what they do in this case.
Yeah.
I don't wanna
With the
see,
kidney,
oh,
with the-
here, we're gonna take out this kidney and put this one in. No, I need to know how that makes sense.
I don't know what else to tell you.
Yeah.
Let's get nephrotic syndrome. Cystitis, inflammation of the bladder, usually due to infection. The patient will complain of urgency and frequency. What does urgency mean?
Tap, or constant.
That's
Or I mean
frequency.
urgency,
Urgency
has
is
to
urgency.
go
Rush.
super bad right now.
Right now.
Gotta go, gotta go.
Right now, yes.
okay.
Okay. Is it break time?
Wow, it is.
Yeah, it's definitely typically.
We were having fun learning about the kidneys and stuff.
We're having such a good urinary system. Ready?
Right,
Yes?
yes.
3, 2, 1.
The PY, we on that PYE.
Pyelonephritis, kidney infection. Dysuria, frequency, flank pain, and fever. What's dysuria mean?
Difficult, painful, or abnormal.
Urination, good. Frequency means
Constant.
constantly having to pee. Flank pain, right back here, just below the ribs, you have that pain.
Below your
Again,
hip?
we're gonna do a little, no, the ribs.
Oh.
We're gonna give a little tap right there on either side,
And that's when it's all there's.
and that's when they scream out the pain.
Oh.
Interesting.
Urinary tract infection, a UTI. Cystitis, pyelonephritis, or both. Common in women. What's the common cause of urinary tract infection?
Bacteria.
Bacteria. And what bacteria from where?
From
Your vaginal canal.
No,
urethra.
it's up the urethra, but where did the bacteria originate?
Under the skin. The skin
No.
area.
Think about what else is down in this area.
Hair.
Yeah, what else?
The hair helps.
You said what else is down there?
Yeah,
Clothes.
This is gonna be some stupidly simple answer.
Mhm.
You're irritating me because you look like we're
Yes.
stupid. We're not. Hold on.
Material,
The
skin,
bacteria
hair,
comes
that's all down there before it hits the
like an abrasion. Is that what you're looking for?
no.
Okay.
flesh.
What other opening is down there?
I literally said the vagina.
The other opening.
Urethra.
The other opening.
The anus.
There you
I was
go.
going for that, but I was like, no way.
And what comes from the
We
anus?
barely talked about it.
Waste.
Waste.
Like actual waste.
Yes,
Not
leftover
that
waste. And what is in that waste?
Gross stuff.
Bacteria. Lots and lots and
And it's
lots and
so
lots
close
of
there.
bacteria. There's a huge amount of bacteria in our intestines.
E. coli
Remember,
is
for
bacteria,
E.
right?
coli is a bacterium, which is one of the things that can cause this.
Yeah.
There is more bacteria in 2 square inches of your intestine than there are people on the planet.
Oh.
And remember, we have what, 30 feet of intestine altogether, with 6 feet of it being that large intestine part. So there's a lot of bacteria down in that area. So yeah, mostly it's enteric, meaning bacteria from the intestines.
Interesting.
Yes. On the top of page 97, nephroblastoma, we talked a little bit about this before. What's blastoma mean?
It's the small.
Collapse.
No, blasto is.
Oh, you're saying,
It's for it's the children.
Embryologic origin.
What is it?
And then we said embryologic origin.
It wasn't like that. It was a different wording, but yeah, you're right.
Coming from the embryo, coming from the original cells.
Yes, original cells. Thank you.
Yes,
Original
thank you.
cells.
Also known as a Wilms tumor. Remember we said we're gonna have this kid bend over with their shirt off, and we're gonna look for one side of their body.
Swollen.
Yeah, looking bigger than the other. We talked about renal failure, uremia, excessive amounts of urea in the blood. That's the waste product that should be removed, nitrogen. Bladder cancer. What causes bladder cancer most commonly?
Smoking.
Smoking. Also, schistosoma infection and naphthalene dyes, but however, we're gonna go with the number 1 cause, 98% of the time, smoking.
Interesting.
Epispadias and hypospadias. That's what we see here. This is hypospadias. Normally, if this is the penis, normally,
If it is?
yes,
Okay.
they just retracted some of the skin here. Normally, the opening of the urethral meatus is here at the tip of the glans penis, right?
Yes.
Hopefully you know this, yes. However, there could be an opening somewhere along the underside, not in all of these, but it could be here, it could be here, it could be here, it could be here. Which means urine is gonna come out.
For the side.
The first hole comes from the bottom. Now, this is common. You're gonna know somebody who has a boy who's born with this. This is the single
I gotta
most
ask around
common.
now.
This is the single most common congenital urinary tract malformation.
For men.
We don't always see it in females because the urethra is much shorter and it's right there, but here it's in the
See?
body. So
Oh my
Y'all may
gosh.
not have periods, but y'all.
I'm telling you, you're gonna know somebody who has a son born with this.
No.
You
I'm
may
sorry, I'm
already,
proud of that.
you may already know somebody who had a son who was born with this.
So it's not something to live with, it's corrected.
It's usually a surgical fix. As long as the urethral meatus is still here, it's a matter of putting a tube in and then just closing off any other hole, yes. But
That is
This
crazy.
is something you've never
I-
heard
in
of
my
before.
mind-
It will only be one.
Yeah, it's
Those
not
are
gonna be
just
all
the
of them.
areas.
Yeah, it's just
Those are
saying,
just the areas it will be in.
correct. The reason for this is because when the penis forms, it forms on top like this, and the front of it forms this way, and it's sort of like zipper shut underneath. So I think everybody in here is familiar with a jacket that has a zipper in it, and
Yeah.
you zip it up, and then it zips, and then there's a space, and then it zips more, and you're like, oh, because now you gotta unzip it to zip it again. That's kind of what happened here. There's an opening that didn't close completely,
Wow.
so.
Oh my goodness.
Most common genital urinary abnormality.
That is
They
crazy.
don't never say they have problems. Like they have problems.
You're gonna
That's
know
a problem
somebody who
right
has a son born with this.
Wow.
Urethritis, inflammation of the urethra, usually due to an infection. It's categorized as either gonococcal urethritis or non-gonococcal urethritis, basically urethritis caused by gonorrhea or anything other than gonorrhea.
Which tells you there's a lot of gonorrhea.
Tells you there's a lot of gonorrhea. Who has gonorrhea?
Everyone.
Everyone has gonorrhea. Thank you. Until you find out differently. Anuria, absence of urine production by the kidneys. The kidneys aren't working. Bacteriuria, presence of bacteria in the urine. That's not good. Urine should be sterile. This is why urine was used in like the Civil War to clean wounds.
Really?
Because clean drinking water was used for drinking. So they couldn't waste it on cleaning wounds.
And they
So they
love
use
their
urine.
alcohol too much to pour it on that.
So imagine just being shot in a field with a big old musket ball.
Stop!
And now, not only are you in pain, you brought
But
out
you
this
got your-
field,
But
but
now
now
you
they're gonna
have
use
urine.
urine to clean out your wound, followed by either like a hot iron poker, or they'll pour boiling oil into the wound
Just so
itself
it can stop.
to cauterize it. Exactly, yeah. Kind of effective, because
Now.
if it's boiling, or if it's a hot iron, well, that's gonna sterilize it, there's not gonna be any bacteria that's gonna survive that, and it would stop the bleeding, but man, that would.
So will they
Yeah,
have,
right there.
so will they have the gallon of urine already on deck, or would they just have their?
Just a buckets, if you have to urinate, go in that bucket,
Okay.
that's all.
Oh my
Hurry
goodness.
up, where's King? Go to the bathroom for your friend. He just got shot. He needs help.
We need urine now.
I ain't gotta go to the bathroom though. Well, get John, he over there. Oh, sorry.
This is why you are not invited to the Civil War, that reason right there.
Yeah, I'm too animated and stuff like
Okay.
that.
Yes,
And this is
we do.
Repeat first.
and then.
Next time wipe off.
The dysuria, difficult pain for abnormal urination, but you know that, that's right, yes.
Yes.
Enuresis, involuntary release of urine. If it happens at night, you call it nocturnal enuresis or segue. Frequency urinating often, we say glycosuria, glucose in the urine. Who's gonna have that?
Diabetic.
Diabetic patients. Who's gonna pee often? Diabetic patients. Remember polyuria? Yes. Hematuria, blood in the urine. Sometimes you can see it, sometimes not. Like sometimes we see a change in the color of the urine. Sometimes it's very, very subtle. So we do testing for that. Hesitancy, inability to initiate a stream of urine. We see that in patients with benign prostatic hypertrophy, guys who have an enlarged prostate for one reason or another. Polyuria, excessive production of urine, so that. Pyuria, white blood cells in the urine. What's that tell you?
There's an infection.
There's an infection. If there's white blood cells in the urine, that means
There's no.
that they're trying to fight off something. There's an infection somewhere. All right, looking at some of these lab tests. What time is it? Kidney function test, BUN and creatinine. BUN stands for blood urea nitrogen. So in other words, we look in the blood to see how much urea nitrogen there is. Blood urea nitrogen. The color of urine is normally clear. However, if it is a milky or cloudy color, we call that the turbidity or turbid urine. KUB X-ray. How do you do an X-ray of kidneys, ureter, and bladder?
You use dye.
We have to have some sort of radio-opaque dye introduced,
And you drink.
because that's soft tissue, or it could be introduced up through the bladder. There's a catheter.
Ooh.
This is a straight catheter. Notice it has a hole at the top. This is gonna go up the urethra into the bladder, and the urine's gonna drain through that, and then out the bottom. You can see that right there.
Is it?
Cause it's
No.
all
Yeah.
She's like, what's this?
Yeah, that's the used one. And then
Right, right.
you'll notice this one is a little different. It has a hole at the top just like that, but it has 2 openings at the bottom.
For males.
No,
That's what I was gonna say.
because we want to keep this in place. So watch what happens. Once we put this up into the urethra, up into the urinary bladder, then we get some saline. That's all this is, like
Oh,
salt
right.
water.
Mhm.
And that goes onto this
Oh,
opening.
so we have to clean.
No, not cleaning. Watch.
Why? Increase the space?
Why does it do that?
Not to open up the space?
Keeps it in place.
Oh.
And the urine still drains out through that hole and comes out here.
So the saline's going through a different tube inside
It's
of
going
it.
through a different tube inside of it. So let me show you in a model here.
Well, that's pretty
Oh,
cool.
you can. Oh, okay.
The vulva.
Okay.
This would represent the vagina, the uterus, the urinary bladder. So this would be lubricated, and this is a sterile procedure. So we use sterile gloves, not just regular gloves. We'd have to use sterile gloves because this is a sterile procedure. We don't want to push bacteria up into this
What's the
person's
difference?
bladder. Sterile gloves come wrapped up.
Oh.
I'll show you. No, they're not numb. This is, well, there's some discomfort.
Yeah, you're gonna feel it.
Ooh.
Oh, I see.
And then,
Oh wow, okay.
Oh.
Interesting.
so that now stays in.
Wow.
And what do we do with that?
This just hangs out and attaches to a bag.
Oh, I always thought it came out the side. Okay, I never knew it came out the.
This is for urine, this is not for poo.
Oh, okay.
That's
That's
a
why I'm
philosophy
getting
thing.
confused. Alright.
This is just for urine. This would be used for male or female. So this would go all the way up the male urethra as well.
All day?
One in surgery?
Yes.
Okay.
Oh, I think my gloves.
And then of course, you just do the reverse to get it out. You suck
Interesting.
that out. Although some people will pull these out on their own.
Mm.
Usually they're
No, that looks
Crazy? or elderly or both. Make sure you get all that. There's actually a model of a male and a female in the lab to practice with these in.
Oh, we learned how to do this?
Was there anything in here?
anything left over.
Yeah, nothing dripping out of there. Okay, good. But you see, they come this way, in a sterile
Sterile
package.
bag, gotcha.
Because this is a sterile procedure. We don't want to shove bacteria up the urethra into the bladder and create a urinary tract infection.
Not at all.
Although,
I would be blaming my dog. I'd be like,
this is
Doctor.
this is one of the reasons why men get urinary tract infections. When
well,
men
that would
get
be one of
urinary
the,
tract
yeah, that would make
infections,
sense.
it's usually from something like this.
That would make sense.
So why do it?
Yes.
If we have a patient who we want to monitor their urine output, in fact, we can, let's say we have a patient with this in them and we have a bag of IV fluids going in, we can monitor how much fluid's going into them and how much fluid's coming out of them and get a really good idea of what we call their glomerular filtration rate, in other words, how well the kidneys working.
Oh,
Wait, so
But if somebody's in surgery, we're gonna put a catheter in. If they're in surgery for any period of time, for a long period of time. Like if they're going in for that heart-lung bypass, coronary artery bypass graft or something.
I never even
That's
thought
a
about
long
that.
story.
Like, wow, like all that still continues.
I did too. That's like, you struck me down.
'Cause
so
remember-
candid.
Yeah, remember, urine's being produced all of the time. Blood is going through the kidneys, being filtered and making urine drip by drip by drip by drip all of the time. Not just when you suddenly have to go to the bathroom. It wasn't just made. It's being made right now. It's being made right now. It's being made right now.
So, when you do the catheter and the urine is now exiting through the catheter, is it more like it's dripping through, the person doesn't have to quote unquote pee, like push anything out, it's just coming through the catheter
Yeah,
dripping?
nothing has to be pushed out because the bladder's not getting stretched to capacity
Yeah,
because.
and it's in the like bladder,
Yeah.
right? So it's just constantly going, dripping out.
Right.
Gotcha.
All right, we're gonna finish this up and then we're gonna go next door and I'll get it finished setting up.
Sounds good.
Diuretic drugs decrease water reabsorption, therefore it's increased water output.
Makes
In other
me-
words, pee a lot. And hydrochlorothiazide, HCTZ, is the one that people are most familiar with, although they don't call it that, they call it the water pill. For obvious reasons. Okay, question.
Yes, I did. I had one question. Can I ask?
Mhm.
So how do you, like, how are doctors able to tell when they say like someone's kidneys are functioning at a 9% or a certain percentage? So that's what I was like, kind of curious about.
Math. We can monitor, well, one from the input output, from the, how much goes in
Ratio.
versus how much is coming out. We can also introduce certain materials that we know will come out at a certain amount, like creatinine at 100% clearance rate, so we can monitor, we can put a certain amount in and watch how much comes out. And that would give us an idea of how well the kidneys are working, at what percentage.
Oh, okay.
So does that mean that that substance is gonna, if the kidneys aren't filtering right, it's just gonna stay in the bloodstream?
Correct.
Gotcha. And that's bad.
That means it's kidneys aren't working, yeah.
Yeah.
It's bad. All right, I'm afraid we're gonna have to end there. I think we're done with the urinary system for now anyway. But we're gonna go next door and help get things set up and get things ready. So I might need